Welcome to this episode of Black Family Doctor, Real Talk About Health and Life. My name is Dr. Aisha Harris, and this episode is about substance use disorders. This is the first episode of the second season, and if you haven't taken a listen to the first season, I definitely encourage you to go over to the Apple and the Spotify podcast pages in order to listen to those great episodes. And for this season, we're trying something new. We're going to have listeners be able to access all the podcast episodes on both video and audio. So the podcast episodes will be available on the Black Fam Doc YouTube page, as well as the Black Family Doctor Apple and Spotify podcast pages. This episode's quote is, "One thing you must realize is that you either kill your addiction or your addiction eventually kills you," from Oche Otorka. Now again, this is the second season of the Black Family Doctor podcast. Along with the video option, this podcast season will also include other guest speakers, occasionally on some of the episodes. And the goal of the Black Family Doctor podcast has always been and will continue to be to improve health information that people are able to access in order to improve both their health literacy and their health access overall. So let's get started talking about substance use disorders. Unfortunately, many people don't think that they have a substance use disorder. And like I said before in previous episodes, all because you don't think that you have a medical problem doesn't mean that it doesn't exist in your system, and doesn't mean that it's not causing additional problems or can cause additional problems in the future. The formal DSM-5 criteria to diagnose substance use disorder is clearly met, unfortunately, by many and millions of Americans across the country who think that their general habit or something they do every single day is not important, that it's not causing them any harm health-wise, financially, in their relationships or otherwise, but it actually is. There are many substances and medications out there that can be misused and can cause dependence and other problems. We will go into the top 4 substance use disorders in America in more details in future episodes, but we'll generally talk about substance use disorders in this episode overall. So what do you think are the top 4 substance use disorders in America? The top 4 probably won't surprise you, because many of them have been normalized across the board in our society. So the top 4 substance use disorders in America include tobacco or nicotine, alcohol, marijuana or cannabis, and opioid prescription drugs. Across most parts of America, these substances are legal, and many people partake in them for various reasons. Other substances that cause substance use disorder include cocaine, heroin, benzos, barbiturates, stimulants, inhalants. There's things across the board that impair and change people's quality of life based on their use and can contribute to substance use disorder as well as addiction. The difficulty with substance use disorders, in addition to people not thinking that they have a problem, is people not thinking that there are options for addressing or treating that substance use disorder. People don't tend to seek out treatment options or be aware of treatment options if they don't think that they have a problem. But they're definitely not seeking out treatment options if they don't want to be treated. This is across the board, whether it's substance use disorders, mental health disorders, physical health disorders. Sometimes people don't actually want help, even if they think that they may qualify for it. In addition to that, it's hard to see that you have a problem if you don't actually feel the consequences, if you don't feel the pain, if you don't feel the injury, if you don't feel the impairment. Right now, it's hard to think that that problem needs to be addressed. If you can't see into the future about what that substance use or that problem may cause you, it's hard to address it right now in order to be preventative, in order to be proactive, in order to prevent things that you can't possibly reverse in the future. Also, if you don't think that a person with a substance use disorder looks like you, then you are less likely to accept and acknowledge that you yourself have your own substance use disorder. Accepting the problem is the first challenge. Addressing it is the next. And with substance use disorder, there's often relapse over and over again before someone is successful. In addition to not being able to be aware that you have a problem, not wanting to possibly address it because you don't think that you have a problem, there are also health access barriers, as there always are health access barriers that play a huge role in how people are able to get resources and treatment options for their substance use disorders. That means that there are resources and treatments that are going underutilized and untouched in many communities because people don't know they have a substance use problem, people don't want to treat that substance use problem, people are unaware of the treatment options, people have barriers to treatment options. The list can just go on and on. There are almost 21 million Americans across the country with at least one addiction or one substance use disorder, but only 10% of them receive treatment. That means that 90% of people with a substance use disorder, as far as meeting the criteria, are not either aware that they can receive treatment, don't want treatment, or are generally just not getting treatment for that substance use disorder. That means that 90% of this 21 million people are causing injury to their body, impairments to their health, and potentially negatively impacting their quality of life now, but definitely impacting their quality of life in the future that they may or may not be aware of because of this substance use disorder. Now, there are criteria that the DSM-5 has laid out in order to determine if someone meets the diagnosis for a substance use disorder. There are multiple things. Not everyone has them each and every time they are diagnosed with a substance use disorder. And depending on the substance, some of these criteria are more present than others. And depending on the person, some criteria are more present than others. So it's really a variety of options that could potentially diagnose someone with substance use disorder. And many people may not recognize that they have a substance use disorder problem because, like I said before, they've normalized the habit. It's part of their way of life. And society has been normalized, whatever it may be. People are often meeting the criteria for substance use disorder without even knowing it. So one of the criteria is spending a lot of time using, or recovering from that use. So you use it so often that you either have to delay something because you're recovering, you're trying to obtain your next supply of that substance. You're just spending a lot of energy and time trying to continue this use. In addition to trying to continue it, a lot of people also have cravings. Cravings because they are so used to using it in such a frequent time or frequent amount that their body is giving them symptoms as far as cravings that makes them want to keep at it. When people have the smoke break because they have nicotine cravings. When people wake up and drink alcohol because they have the craving when they wake up. Whatever it may be, cravings are part of the substance use disorder criteria. The next one is continuing to use even when it causes problems or danger. An example of this is when people get a DUI for alcohol intoxication while driving, but they still continue to drive even when they are under the influence of alcohol. They're continuing to use the alcohol even when it's caused danger. And that danger can be causing injury to their own life or someone else's life. Giving up activities and things because of use. So if you used to do something, but it's hard to do it because you rather do something else that's related to the substance use, you're giving up some of your day-to-day life in order to continue this habit or continue this general use of this substance. Another criteria is being unable to cut down. So you use so often that the idea or the action of trying to cut down is very difficult. Either mentally or physically is very difficult. Sometimes people even develop withdrawal symptoms because they use so often that their body is used to a certain amount of that substance in their system. And when they possibly a little bit go down as far as the amount of that substance in their system, whether it's nicotine or alcohol, opioids or marijuana or cocaine, whatever it may be, your body is so used to having a certain amount of it in your system that when it goes down to a certain point, you start having withdrawal symptoms. Where there's cravings, where there's headaches, where there's agitation or irritation, where there's drowsiness, where there's palpitations, your heart racing. There's a lot of things that withdrawal symptoms can cause. And sometimes your withdrawal symptoms can be so bad that you end up in the hospital. You end up needing additional medicine in order to decrease the significance of the withdrawal symptoms. You can even have seizures because your withdrawal symptoms are so significant. You can even have breathing difficulties because your withdrawal symptoms are so difficult to deal with. Another thing is needing more substance to get the same desired effect. That's in the context of you've been using this so often for so long that the receptors in your body are so oversaturated that you have to use a little bit more the next time in order to receive that desired effect, to get that euphoria, to get that kick, to get whatever symptom or effect that you like that you get with that substance. You have to use a little bit more. That's a criteria for a substance use disorder. Like you're getting more and more in your system to receive that same initial effect because your body's so used to it. And then the last criteria for potentially having a substance use disorder includes continuing to use even though you have a problem. Like, you're aware of it, your friends and family have told you, your children have told you, your colleagues have told you, society has told you that, hey, maybe you're using that substance too much. Maybe it's impairing your relationship, maybe it's impairing your employment, maybe it's impairing your ability to drive, your ability to think, ability to take care of yourself, dress yourself, whatever it is. You're having a problem that's related to this substance use, but you're still using, even though you're aware of your problem, because it's so difficult to stop. Either you don't want to stop, you can't stop, the circumstances around you make it difficult, whatever it may be. You're aware of this problem, but you're still unable to stop. Now, if someone has a couple of these criteria that we just went over, they might have mild substance use disorder. If they have at least 6, then we consider that severe substance use disorder. But either way, having a substance use disorder still allows you to meet the criteria to access treatment and resource options. Whether it's mild or severe, there are options for you. There are medication options, there are therapy options, there are organizations within your community that are really trying to address substance use problems because they impair a person's ability to improve their quality of life, to access employment, to access resources in the community, to have great relationships with their family, with their friends, to be able to enjoy things sometimes that they aren't able to enjoy when they have this substance use problem really taking advantage of their life. Whether you're mild or severe in your substance use disorder, you can get help and you can qualify for help. If you yourself have concerns about having a substance use disorder, or you know someone that possibly can have a substance use disorder, there are resources nationwide, locally and statewide, that can help you out. Whether it's your local doctor's office, whether it's your local substance use disorder facility, your local health department, your statewide health department, there are people and resources and organizations out there that can help you with your substance use disorder. Whether it's tobacco use, whether it's alcohol use, marijuana use, prescription drugs, heroin, cocaine, barbiturates, benzo, stimulants, inhalants. There are a lot of things out there that considered part of the substance use disorder criteria as far as the substances, and there are a lot of people who meet the criteria if they look at themselves and look at their lives a little bit more closely. And health professionals like myself, as well as social workers and community workers, are out there wanting to help people if they're ready to be helped. If you want to access help for yourself or potentially give information to someone that you know, you can go to the SAMHSA.gov website in order to see about treatment and help options locally and statewide for you. That's SAMHSA.gov, Substance Abuse and Mental Health Services Administration. You can also call their national hotline at 1-800-662-HELP or 1-800-662-4357. They'll be able to connect you with national resources, statewide resources, and additionally local resources that can help you or someone you know address their substance use disorder problems. You can also always ask your primary care doctor or the other local organizations that are related to healthcare in order to figure out where you can access some of your local spots or resources. So as much as there are options to get treatment for substance use disorder, there are also a lot of challenges. There are challenges to both acknowledging and treating substance use disorders. There are negative stigmas that play a huge role in how people access help and resources because they're nervous, they're apprehensive, they don't want to be labeled some sort of way because of the history and perspective this nation and society has had against people with substance use disorders. Especially because some substance use disorders are normalized, like cigarettes and alcohol use, while others are looked a little bit more down upon as far as cocaine or heroin use. These are all substance use disorders. These are all medical problems that have medical treatment options, including medications and therapies that can help someone overcome this substance use disorder and decrease the risk of complications and consequences to chronic substance use overall. Now, there are regulations and laws created that cause the nation to have a specific perspective against people who have certain substance use problems. This perspective also impacts the racial and economic stereotypes that exist in our society. There are a lot of people who are labeled one way because of their substance use when someone of the same class but different race may be labeled a different way. Or someone of the same race but different class may be labeled one way, positively or negatively, based on their substance use. In addition to the negative stigma associated with substance use disorders, there's also a huge financial incentive to keep some of these substances in circulation. The selling, the supply and demand of these substances causes a very big financial growth in many communities and many individuals' pockets. Even though they're known to cause dependence and addiction to negatively impact individuals' lives, their families' lives, and some lives of many people in different communities and neighborhoods. These substances make a lot of money. That's not really a secret, but there's a lot of evidence and experience that shows the harm that these substances have on communities, especially communities of low-income individuals, as well as Black communities and minority communities. I'm not saying to eliminate all substances. I know people have their rights to make decisions. I kind of just really want there to be equitable distribution of the regulations and criminalization of substances, of their consumption, of the things that happen when people are intoxicated. These things cause harm to individuals and their communities. These things cause harm to individuals and their communities, especially in communities that aren't given the opportunity to have resources to help decrease their substance use disorder, to help decrease their addiction, to help decrease their dependence. They're just continued in this cycle of substance use problems, and substance use problems are not siloed. They stretch into the next bedroom, into the next house, to the next neighborhood, to the next community, to the next generation. It's just a continued cycle that many communities are unable to get out of because of the financial incentives and because of the under-resourced areas that they live in. Substance use disorders are behavioral health and mental health disorders. There are many known barriers to the health access and to mental health crisis interventions in low-income communities and Black communities, from the shortage of health professionals and social workers to the accumulation of chronic stress and traumatic experience over generations that influence behaviors, circumstances, relapse, and retention. We can't criminalize substance use disorders on one end, but also glorify other ones on the other end. But medically speaking, they all negatively impact our health and our lives. But why are some communities more impacted by substance use disorders than others? Just because others, like I said, are more glorified substances while others are more criminalized. I hope those listening recognize that substance use disorders are more prevalent than people think. Substance use is a thick topic and sensitive for many people in many communities. Now, future episodes will dive deeper into the top 4 substance use disorders, like tobacco use disorders, alcohol use disorders, marijuana use disorders, and opioid use disorders. There are many health disparities that surround substance use disorders and many opportunities for people to learn more about the stigmas, barriers, and resources that exist regarding substance use. The data says we can improve. It is shown that we have improved on our substance use status and the health of those who used to use substances overall. And there has been great progress in closing the health disparity gaps as well as the racial disparity gaps that exist. So look out for future episodes on specific substance use disorders and other topics that people don't like to talk about but should talk about in healthcare in order to discuss what needs to be understood in order to improve health literacy, health understanding, and provide you with information to help yourself, but also the people around you. Thank you for listening to this episode of Black Family Doctor Real Talk About Health and Life. My name is Dr. Aisha Harris, and I appreciate you listening to this episode. I hope you join in other episodes as we learn about other health disparities, improve health literacy, and just improve our health information overall. This episode's quote is, "One thing you must realize is you either kill your addiction or your addiction will eventually kill you," from Oche Otupwa.